Hello, I'm Dr. Heidi Horsley, Executive Director for the Open to Hope Foundation, and I'm here today with Deborah Antinori, licensed professional counselor, registered drama therapist, and certified grief counselor. Our topic is practical and emotional issues of pet loss. Deborah, what may a person experience emotionally who has lost a pet?
Really, it's really what you would experience when you have any kind of loss. There may be feelings of sadness, tearfulness. There can even be depression or anxiety because these pets live in our homes. They're with us every day, and when they're suddenly ripped away, it can feel like something is very, very wrong. People may feel anger. They may feel angry at themselves that, oh, why didn't I notice? Why didn't I take them to the vet sooner? When in fact, pet owners really do the best that they can, and we're not God. We're not in the position of choosing life and death. They may feel blame. They may blame the veterinarian that they couldn't help the pet. Blame them. So people may go to a group for pet loss, and when someone goes to a group, they can get support for their feelings from people that have had a similar loss. So that's great, but it has some constraints in that the depth of what they may want to talk about and other losses that may be coming forward that they remember. They may not have the time, so individual can be really great, and there are people that do individual pet loss therapy where you may remember when your mother died or when your grandmother died, when there was a really difficult move when you were a kid and went to a different school. Surprising things can come to people, and even things that they aren't really aware of, but they may have sleeplessness, or they may have a lot of stomach trouble where they weren't having that before. It's their body telling them there's more here for you. So please see a professional if this should happen for you.
And it is good to know that there's groups out there. So Deborah, what are the best and worst things to say to someone who has lost a pet?
Some of the worst are, as I'd said before, you'll get another one, as if they can be replaced, or aren't you over it yet? That's probably one of the worst. Again, making the person feel like there's something wrong with them. So the best things you can do are sometimes just be quiet and let the person talk, but saying something like, I'm so sorry for your loss. Tell me about Sparky, tell me about Fido. Let the bereaved talk. If it's true for you, say, how are you doing? What can I do for you? Maybe you can bring over a casserole, watch the kids for a while for them so they get some time for themselves. And if it's true for you, again, say, I loved Sparky too. I remember when he used to come over and when my kids were young, and tell them that what great care they took of their pet. These things are helpful to your friend or your family member.
Very good, Deborah. So how does a pet guardian decide when to choose euthanasia?
This can be a difficult thing for people because we don't have this with our human companions. But 3 prongs are really important that Laura Lagoni has brought up from she used to work for the Colorado State Teaching Veterinary Hospital. The quality of life signs. What are the look in the eyes? What is the what's normal for your pet on a day-to-day basis? Pet owners know this. Then what are the physical signs and symptoms? Is the dog really having problem with their hips? Are you having to carry them outside, a large, a St. Bernard? Are they being incontinent really regularly? And then your own quality of life. Is your back hurting you from helping the dog to get outside? What's going on in your family? Is the family in chaos or disrupted because you don't want to face the moment? So stay in close contact with your veterinarian and have them go over this list with you of those 3 points. Ask the vet, can there be palliative care to help them when they're having pain or when you're maybe not quite ready to let them go yet, or even to the edge of hospice care, depending, you might be a nurse, you might be somebody who's comfortable with that. And then when the moment comes, if you've decided before, if your vet can come to the home, some people really like that, and include family members. And don't forget the children. This is their pet as well, and it's an opportunity to teach them about death and loss and include them using clear, appropriate language to their developmental age. Try to avoid euphemisms like go to sleep. They may be afraid to go to bed at night, and it's an opportunity with your children.
Very good advice. So when should a person get another pet?
Well, this is very individual. When they've worked through those raw feelings of grief, that they're not in a place where they're trying to replace the pet for the difficult feelings that they're having. So maybe they've gone for some group counseling or individual counseling, and they feel ready to accept a new pet for who that pet is, because there can be very painful comparisons when the new pet comes, and they may feel badly that, oh, I do love the new pet, but it doesn't remind me of when Barney, used to come and greet me at the door. This one kind of waits for me and then does a little run out, and it's startling to me. So it's very individual, but some people who may have underlying anxiety and depression that they have been dealing with their whole life, or find out that this is what's going on for them, they really feel unsafe without a pet in their home. So to go out and get another is really okay. If you know you're that kind of person, you just feel better with the pet there, be kind to yourself. Do what's right for you.
Very good, Deborah. I think this is such very important information, and like you said, it's something that's not talked about enough. So I want to thank you so much for being here and for helping people that have had a pet die find hope again.
Thank you. I appreciate the opportunity.